want to tell you about white-eyed shunts. So what I mean by that is a carotid cavernous fistula, which is a form of a dural arteriovenous fistula between the carotid artery and its branches, either the ICA or the ECA, the external carotid, or the internal carotid, and the vein in question is the cavernous sinus. And so when you have an abnormal connection between the artery and the vein without an intervening capillary bed, we call that an AV fistula. And the AV fistula in the cavernous sinus is called a CC fistula. The reason you need to know this is the flow determines the presentation. So when you have the eye, the major draining veins of the eye are the superior ophthalmic vein and the inferior ophthalmic vein. Although the superior ophthalmic vein is the predominant drainage of the orbit, this drains into the cavernous sinus. And so inside the cavernous sinus is the intracavernous segment of the internal carotid artery. And there are branches of the external carotid artery that anastomose very close there. The most prominent is that middle meningeal artery. So if you have a tear in the artery, in the ICA, you'll have a direct high flow fistula. There'll be arterialized blood go into the cavernous sinus, and then that will be transmitted retrograde, the wrong direction. It will cause increase in the superior ophthalmic vein because the blood can't drain out of the eye. This is going to be a red-eyed shunt. So they're going to have big muscles because the blood can't drain. They're going to have glaucoma because increased episcleral venous pressure. They might have retinal venous dilation and a swollen optic nerve. They might have edema. And all of that is from the SOV being blocked because the flow is going the wrong direction. So they're going to have proptosis and chemosis and injection. This is a red-eyed shunt. So when you have a direct tear in the internal carotid artery, that's called a Barrow type A direct high-flow traumatic fistula. That's the easiest one to diagnose. Sometimes, though, it's the internal carotid artery, but it's just the branches. That's going to be a low-flow fistula. And a C is external carotid artery branches, also low-flow fistula. Or you could have D, which is a combination of both internal and external carotid artery. This is Barrow classification of carotid cavernous fistula. So the white-eyed shunt is a little bit tricky because instead of getting retrograde flow into the superior ophthalmic vein and a big bulgy red eye, the flow is going posteriorly and posteriorly down the petrosal sinus, inferior petrosal sinus, and down the internal jugular vein. And so this posterior draining fistula is actually going anterograde. It's going in the right direction, but a posterior draining carotid cavernous fistula is going to produce a white eye because you don't have any of the drainage into the orbit. So that type of fistula presents with just cranial nerve palsy, like a sixth or a third that's chronic. They may or may not have pain, but the eye won't be red. That is a white-eyed shunt. So they're both shunts. They're both fistulas. One is anterior draining and the other is posterior draining. One is retrograde flow, the other is anterograde flow. And the white-eyed shunt is the one that you miss because the eye is white.